Hi there, this is Dr. Paul and thank you so much for tuning into this video from Waterfront Dentistry by Paul's. Now we'll talk about the second phase or the second part of this video on how to restore missing teeth using either implants or partial dentures or even a complete denture. So let's talk about the expenses and take that as our gauge in figuring out what we want to talk about first. So you have a missing tooth or a missing bunch of teeth, how do you fix it? The least expensive thing, of course, is no treatment. Now, the problem with no treatment is whenever you take a tooth out or a bunch of teeth out, within the first 3 to 6 months, the most amount of bone loss occurs. Now, what this means in a nutshell is, according to Wolff's law, whenever a tooth is around a bone or an implant is around a bone, there is stimuli that exists to give the bone a signal to stick around. Now, when the tooth is taken out or when an implant is not placed at all, the bone starts resorbing or going away with 3 to 6 months being 50 to 70%. Now, what that means is when you lose bone, you basically narrow your options or your treatment modalities don't have as much potential. What happens when you lose your teeth is your vertical half of your face collapses, which means your height of the face goes away to some extent and you end up having a lot of wrinkles, a lot of folds on your face, and most importantly, you lose that muscular tonicity of your face. And to a lot of people, this is frustrating because now they look older than they should. Let's talk about complete dentures because that's the most or mostly used because it's the least expensive modality of restoring a bunch of teeth. So complete dentures have been around from a long time, and the reason for this is acrylic, which is a different kind of plastic, has always been accessible to a lot of people for a fair less cost. Now, what acrylic is a combination of something called monomer and polymer, which is powder and liquid. And the acrylic only needs 2 millimeters of depth or height to give it a strength to house 6 to 8 millimeters of fake white teeth. Now, the reason why dentures are very important, whether you go with dentures that are supported by implants or just your conventional dentures, is the denture sets the tone for your entire face. So your face is housed by muscles and your muscles stay muscular because you have teeth and bone constantly stimulating it. When teeth are out and when the bone starts resorbing, you lose facial height. And then what happens with that is whenever a denture needs to be made, we need to make it because of the lack of muscular height, and also the speech patterns of that patient starts lagging. So this is why making or fabricating a conventional denture is the first phase in setting up any situation to restore this person's vertical height, speech patterns, and muscular appearance. So with complete dentures, your primary stress-bearing areas, especially for the upper, are your maxillary tuberosity, which is this big buttress of bone towards your second molar, and your hard palate. The secondary stress-bearing area is your alveolar ridge, which is where your teeth used to live, or the bone that housed your teeth. And your stress-relieving areas are your nasopalatine canal, which houses a bunch of nerves that stimulate your hard palate, and your mid-palatal raphe, which is the suture line between your palates. Upper dentures are fairly stable because you have a lot of real estate in that all these areas don't move whenever you smile, talk, chew. Your bottom dentures, the primary stress-bearing areas, are your buccal shelf area and your retromolar pad, which are these thick buttresses of bone towards, again, your second and third molar area. Then you have the secondary stress-bearing area, which is your alveolar ridge that used to house your teeth. And with your relieving areas, they are towards your vestibules and your tongue. So lower dentures are extremely uncomfortable because everything around your complete denture, lower complete denture, moves. So this is another reason why if someone's on a budget or they don't have too much of resources to spare, we tell them to keep as many lower teeth or bottom teeth as possible and sacrifice more upper teeth. Now, once this is done and the patient is happy with the retention or the lack of, then we can always talk about how to compensate and make things even more retentive. So phase one is always making a conventional denture that fits really well. Now, with implant supported dentures, the first or the most important thing is to have enough of bone in the position that the implants need to be placed to house the denture that you've already made conventionally. So this is a very interesting concept because usually people go and tell a dentist, look, I want an implant or a bunch of implants and I want that to house a denture. The whole thought process should, from the dentist, should be, let's make you a conventional denture which you're happy with the vertical length of your face and your muscular tone, and after that let's figure out where the implants need to be placed or inserted into your bone to house that well-made conventional denture. So this is the most important, I guess, phase in restoring someone's lack of teeth, which is a conventional denture. Now, number two is an overdenture. So what's an overdenture? An overdenture can be tooth retained or implant retained. So a tooth retained overdenture uses teeth that have had root canal treatments and copings or these metallic shelves over the root part of the tooth. Now, the reason why we do this is, like I said again, if you take a tooth out, you lose a lot of bone length and density and height. So what we do is we end up root canal treating a tooth so that we can lop off the crown part of the tooth. Now this is in case the root is in fairly good bone structure, so it doesn't have gum and bone disease, but say it had a couple of very deep cavities or infections. So a well done root canal will prevent the infection from growing, but it will also keep the root lodged into bone and hence keep the bone from resorbing. So when you have a tooth supported overdenture, it's a little more expensive than a conventional denture, but still very, very much affordable. Now we can come on to talk about implant supported overdentures. So with implant supported overdentures, you have solo or a bunch of implants. So when you have solo, which means you have one, it's not very retentive or very supportive. But when you have two implants by the bare minimum, we call this implant supported overdenture with studs or a bar. So a stud basically means an overdenture that's being held down by a clip and a locator. A locator is an abutment that sits over the implant, and it has a little ring or a little housing over which a clip or a bunch of clips from your denture can house onto or can click onto. So with the implant supported overdenture that is a stud attachment, you have a couple of advantages and a couple of disadvantages. The biggest advantage is it's fairly inexpensive, and also it's fairly retentive but not very stable. So what that means is, you can smile, you can talk without your denture moving, but if you bite down or eat or chew on a little more chewy food stuff, there is a chance that the denture might come undone from the locator and the rings attached to the inside of the denture. Now, if you go with the same concept but have the 2 or the 3 or even the 4 implants connected with a bar, the bar can now house these locators. So with both these implant supported overdentures with a stud or with a bar, the denture can be taken out by the patient, cleansed and put back in. The only difference being the bar has locators that is screwed on, which means that the denture will click on to a locator which is now screwed onto the bar. I hope that isn't too confusing. The takeaway message should be here is if you have 4 implants or 3 implants or even 2 implants that have stud locators, your conventional or denture can be made into overdentures, and the little rings or the little tubes will last you longer than 4-3-2 implants connected to a bar that houses locators that are screwed onto, where your denture will be a little more retentive, but the little rings will lose its elasticity and pop off much quicker. And the reason behind this is when you have single locators, the rings have more play, so the elasticity is held on for a little longer. But when you have the same locators that are attached to bars, when the denture is put in and taken out, the elasticity goes away quicker, and that's why you need to replace them more often. So this is implant supported over dentures. Thanks for watching.